recently have crossed over to the theoretical dark side, so to speak. I'm in education now. I really got my first foothold in talking at these conferences with GCOPA back in March. That was my first time ever talking in front of you, just all you distinguished people, and somehow you keep asking me back. So I guess I'm not doing a terrible job. So first, I want to reach out and thank Bishop Aban, Joel Potty, and Mr. Arco for just inviting me and being so gracious with everything. I'm just so blessed to have in my lives, and raise me up and help me proceed with this career that I'm trying to put together here. But so let me talk more about what I'm here today. So as we all know, the pandemic has given us many challenges. And essentially, I'm working on my doctorate, and I've had some challenges doing research, and I wanted to talk to you about how I've overcome them and how we might be able to utilize some of those tools for other things as well. So first, I need to do a disclosure. I have no personal or actual potential conflicts of interest in relation to this program or presentation. I will be talking about some products that I have used, but I am not endorsed or do formally endorse either one of those. Before we get started, I wanted to put this up here. This is one of the tools that I'll be using throughout the presentation. This is a QR code, and if you have a phone, you can scan this code, and it'll come up with a little quiz, and at the end, we'll go over the results, and I'll show you how it works. But don't worry, it's going to stay on the screen the whole time, and you can actually see, if you can't see it, it will, oh, what happened here? Yep. So if you can't see it, it'll be right there. So first, I want to talk about global health. Global health is a commonly used term that transcends natural borders, class, race, ethnicity, and cultures. When we talk about global health in regards to disease, we have to realize that even though some diseases be more concentrated in geographical locations, there are certain conditions that foster the persistence or cause them to remain unchecked. These include issues of poverty, limitation of access to healthcare, environmental pollutants, and environmental degradation, war, and political conflicts. In the face of COVID, we have quickly learned that diseases that occur in other countries or continents cannot be ignored. COVID has unified us. It has unified us as a planet, and we must educate in the same mindset. Research progress has been impacted, the traditional ways that we do it, the ways we conduct research, and we must innovate in the face of this adversity. We are physician assistants and clinical officers. We are no stranger to adversity. And one trait that is sewn into the fabric of our passions is our ability to find a way. The pandemic is no different, but I wanted to share with you a couple of opportunities where we were able to innovate in the sight of adversity. This is point of care ultrasound that has been used in the South Sudan, very rural areas where there is no opportunities to get formal diagnostic measures without having to travel long distances. Point of care ultrasound has changed the way clinical officers are taking care of patients in the South Sudan. They're able to monitor pregnancies and take care of complications earlier. They can use the point of care ultrasound for pneumonia, pulmonary heart disease, heart failure, and acute conditions in the abdomen that require surgery that maybe they have been misdiagnosed or underdiagnosed for a long time. In the, sorry, let me shorten this up here. In Malawi and Rwanda, mental health issues have been long ignored, and the collaboration between local government and the uh, health centers for mental health, collaborated with the local um, clinical officers to actually establish mental health programs to actually expand services for the local community, and they have long improved the mental health quality in that areas. So these fellowships and these innovations developed out of adversity and lack of resources in the area. But let me tell you about my recent challenge and the solutions. So essentially, but a little background first. Essentially, this is me. Not only am I a physician assistant, but I'm a CPR instructor as well. And I do CPR instructors for the community as well as healthcare providers. And what we learned, but what I wanted to talk about is my research a little bit, because my research for my doctorate degree was a combination of these two skills. I was going to perform CPR classes for the local community. The reason why is because cardiovascular disease is the #1 cause of death globally among men and women. Out of hospital cardiac arrest, which is defined as a death that occurs within 1 hour of symptoms and usually are from arrhythmic sudden cardiac death, most commonly ventricular fibrillation. The benefits of CPR include that if it's witnessed and the patient can get CPR within 2 minutes, their chances of surviving the event increase threefold. But there are many barriers for people to do CPR and to obtain CPR training, which was the highlight of my research, was to provide CPR training for free of cost to immigrant and refugee communities within the United States, specifically in the Chicago area where I reside. But because the barriers that already existed, just got compounded with COVID, because community centers started closing and other facilities where I was going to do the classes also started closing. So I was asked to see if I could develop a virtual CPR class. Now, if anybody has ever done a CPR class, you know that this might be very difficult, because now you have to distribute mannequins so people can do compressions and learn how to do them. You have to be able to provide video instruction and give a pre-test and post-test. So you think, oh my gosh, how am I going to do this virtually? Because it's never really been done. So I was essentially having to create something in the face of an adversity. So I thought to myself, what did I need? First, I needed a video, which I was able to obtain from my local CPR coordinator. And actually, I was able to get an English and a Spanish version, since my target audience was immigrants from Spanish-speaking countries. So that worked out really nice, and it didn't cost me hardly any money. The mannequins. Now that in itself was a little bit more of a challenge. This was definitely harder. But then I thought, can we make mannequins out of household items? And the answer to that is yes, we can. And I wanted to share with you a quick video of how to do it.
A do-it-yourself CPR mannequin is a great solution to being able to practice CPR from your home. Let's learn how to make your own do-it-yourself CPR mannequin with items you might already have laying around your home. What you're going to need is a t-shirt, a 2-liter plastic bottle, 3 rubber bands, and some type of filler, such as newspaper, paper, or plastic bags. To create the CPR mannequin, you're first going to ensure the 2-liter bottle is completely empty with its cap screwed on tight. Take your t-shirt and tie a rubber band around each of the 2 arms and the bottom of the shirt, as seen in the picture. Insert the 2-liter bottle into the shirt in the center of where a person's chest would be on their breastbone. You can see the placement in the image, but you want to make sure the bottle is actually inside the shirt. Then you want to take the filler and insert it into the shirt around the bottle, ensuring that the bottle stays aligned down the front center of the shirt where the breastbone would be.
So I actually made one. It's right here. I'm a hockey fan. So this is a Chicago Fire hockey shirt. And if you listen, It works perfect. So that is what I used to do my class. Everybody built their own at home, and we were able to use the video, and they could practice on their own homemade CPR. But then I thought, what am I going to do with the test? Well, remember that QR code that I introduced at the beginning? Well, if you haven't scanned it yet, this is your last chance, because now I'm going to compute the results of everything that you guys have done. So I use that scan to make my pre-test and post-test. Essentially, and these are my examples of my tests that I have up for you. You can scan them if you like. But now these are the tests. So if you want the one for your own personal test, that was on the previous screen. But let's take a look at the data. Let's see who participated. So it doesn't look like hardly anybody participated, just a couple people from the United States, but I could get the results immediately. Let me refresh and see if anybody else. Oh, no, got a couple more. Here we go. They're coming in, flying off the shelves. So it looks like we had a couple from the United States. We had one from the other. And it looks like people are responding. If you could notice, I was able to get these results super quickly. It's updating almost immediately into my computer, and then I can download it as an Excel spreadsheet and compress the data for research. So these test results went into an encrypted site. And then I was able to make sure they stayed anonymous, and I was able to really obtain things in real time. So I wanted to make sure that you saw that these were very functional and work across the internet and across the globe. So let's a little bit about QR codes and global health and literacy. QR codes themselves are not new. Since 1994, they've been used, but repurposing them for new patient engagement, that's new. And many doctors' offices are realizing that through telehealth, they can't provide the information that they want to their patients. For instance, if you scan this is the dosing schedule for children's Tylenol. So if you scan this on your phone using your QR scanner, you can actually download that, bookmark the page, and you'll always have the information, which is so much more valuable than giving out pamphlets or leaflets or posting something on the wall. Because if you post something on the wall, they can't take it with them. They're only kind of relying on their memory of how they interpreted what they read. Now, if they scan this, it's in their phone, they can bookmark it, and they can have it for a long time. Most people have cell phones more than computers, so you can forward them like real information from the World Health Organization or whatever your community health systems are. You can have an opportunity for them to immunization shots. So if you want to make sure that they're getting their scheduled shots or their scheduled immunization, you can send them the schedule. They can schedule things for themselves right on the site that you provide. The essential, easy to share, vital information. So next, I want to talk about where used. In the United States, in a rural Iowa, which I know you don't know where Iowa is, so I provided this map so you can see where Iowa is in reference to country. So it's in the middle of the country, and it's essentially it's a whole farming state. So you can see below, this is the metropolitan of Iowa, very rural, a big farming community where their visits while the patients are waiting in the office. They have these little scans, these little QR codes all over the office. And have information about eating healthy, immunizations, and the options for family. You can hit audience directly, creating a QR because of COVID, and able QR codes may be priceless, and it's going to be extremely easy to connect with everybody on a more real-time basis. In my references, I have all the information regarding how to download your own QR scanner and how to download your own QR codes, so that will be available. If you need to reach out to me, this is my email address, but that's an old QR code that I created with my pretty little picture in it. And that's how easy it is to make. So you can make your own. If you scan this, it'll go directly to an email with my name in it. And all you do is type and send. Okay, thank you very much for your time. And thank you for letting me speak here today.